Granny shot.
Oh!
Hey guys, I'm just gonna sit down for a little bit.
Come on, man. You better be angry. It's like,
I just need a few minutes.
Can you handle this later? Come on.
Give me a shot. You didn't see that coming.
Oh.
DJ.
DJ.
You alright?
DJ, are you okay?
DJ.
He's not breathing, guys.
You alright?
Sudden cardiac arrest is a leading cause of death for Americans. It is a condition in which the heart suddenly and unexpectedly stops beating. If this happens, blood stops flowing to the brain and other vital organs. It can happen to anyone at any age. Cardiac arrest usually causes death if not treated within minutes. To understand cardiac arrest, it helps to understand how the heart works. The heart is controlled by an electrical system that maintains the rate and rhythm of the heartbeat. Sometimes problems occur with the electrical system, leading to irregular heartbeats or arrhythmias. There are many types of arrhythmias. The heart can beat too fast, too slow, or with an irregular, inconsistent rhythm. Sometimes an arrhythmia prevents the heart from pumping blood to the body. That is a cardiac arrest. Remember, sudden cardiac arrest is not a heart attack. Instead of a problem with the electrical system, a heart attack, or myocardial infarction, is caused by a plumbing problem. A heart attack occurs when a blood vessel in the heart is blocked. That blockage stops the flow of blood, leading to an area of dead heart muscle. While not the same, a cardiac arrest can occur during a heart attack.
You alright?
Someone go get the AED.
Okay, let's go.
Someone call 911. Yeah.
I got it.
And get an ambulance.
Each year, about 350,000 adults experience cardiac arrest. What may surprise you is that nearly 1,000 children and adolescents can also experience cardiac arrest in that same year. It's very important to be aware of both you and your family's medical problems because some individuals can be more susceptible to cardiac arrest than others. Even young people can have genetic or physical characteristics that could lead to cardiac arrest. Your doctor can help you to determine if you have an existing condition. Additionally, certain injuries or medications can increase the risk for cardiac arrest in otherwise healthy people, especially illegal drug use. Many people can have cardiac problems without even knowing it. That means that they may not know that they are susceptible to cardiac arrest until something happens. For that reason, it's important to know the signs and symptoms for potential cardiac problems in both you and in others. They include fainting during strenuous exercise, unusual shortness of breath, excessive sweating, extreme fatigue or loss of muscle control, or pain in the chest during exercise. You should be especially aware of these signs during periods of high exertion, such as during gym class or doing sports. With any cardiac arrest, time is very important. Once an attack occurs, a victim's chance of survival decreases rapidly after every minute that passes. If you witness a cardiac arrest and find no signs of life, such as breathing or a heartbeat, remember these three things: 911, continuous chest compressions, and AED.
Is he alright?
If he's breathing, someone go call 911.
I got it.
The first thing you should do upon witnessing a cardiac arrest is call 911. That way you can tend to the victim until the responders arrive.
There'll be someone out there waiting for you guys.
The next step is called continuous chest compressions. It is commonly referred to as compression-only CPR because it doesn't require mouth-to-mouth. It is the procedure of simulating a victim's heartbeat until help arrives. This is done through chest compressions. Here's how it works. First, intermingle your fingers and latch your hands together as shown. Then place your hands on the sternum at the center of the chest. Apply short, abrupt presses to the chest at about 100 beats per minute. If you don't have a metronome available, think of the Bee Gees' Staying Alive. Remember, push firmly.
Guys,
Is he alright?
someone go get the AED.
Okay, let's go.
An AED is used to safely deliver a measured electrical shock to the victim. The shock can help to stabilize the victim's heartbeat. AEDs should be posted at various locations around your school and at other public locations. It's a good idea to be familiar with all AED locations at your particular school. You must expose the patient's chest to allow placement of the pads. Place pads on patient's chest as shown in the picture.
You ready, DJ?
Power up the device and it will walk you through the steps. Follow the prompts from the machine.
Stand clear.
Okay, you guys want to stay clear, okay?
Analyzing now. Stand clear.
The machine will determine if the patient's heart can be helped by a shock.
Shock advised.
Once the machine is charged, assure that no one is touching the patient and push the shock button.
Stand clear. Push to shock. Start CPR.
Once the patient is shocked, you should immediately begin chest compressions again and keep doing them until help arrives.
Keep pumping.
Collapse.
Just collapse.
Every second counts.
Does he have any history of anything like
Not
this?
that we know.
No.
Remember, cardiac arrest can happen to anyone at any time.
Dad, I brought you some. Dad? Dad! Dad! Dad? Dad?
What happened? What's going on?
It's my dad. I think he had a heart attack. Can you call 911?
Sure, yeah.
Dad. Dad.
Hi, my name is Chris Lang and I'm at 215 Glenhaven Court. And my neighbor John, I think he's having a heart attack in his garage.
Did you call them?
Yeah, I got him on the line. They're on their way. Yeah, his daughter's with him now. She's doing chest compressions. Yep. Okay. A great way to be ready for emergencies is through training. Get more information by visiting these websites.